Lisa Galetta.
Thank you. Good afternoon, everyone. My name is Lisa Galetta. Thank you. I have an MPH in health policy and socio-medical sciences, and I work with the Institute of Women and Ethnic Studies. We're a nonprofit translational public health organization located down the street, dedicated to improving the health of women of color and their families. And I wanted to go back to Ms. Hoffpower's presentation first, regarding some connections that she mentioned between mental health and the criminal justice system, which I completely agree with, so I wanted to highlight that. One thing that I don't 100% agree with her on was regarding the advancement and the sufficiency of workforce training here. I don't doubt that there are mental health professionals in this area, but I also want to highlight the lack of specific training to address post-traumatic stress disorder, which affects a large proportion of our community population. I do believe that the mental health system treats the manifestations of this disorder when they get to a certain point, or chronic livable conditions such as depression and anxiety, but not the symptoms of post-traumatic stress, period, which are clearly not being bettered by the situation here with respect to housing and healthcare that people live with chronically. I also agree with Dr. Moises in the sense that he mentioned that there is a public health crisis in the city of which mental health is a part. Personally speaking from the Institute, in the past couple of months we've done 100 interviews of your constituents here in the greater New Orleans area since February 2009, and 100% of the people who we interviewed agree that there is a state of crisis or state of emergency or chronic state of suffering, either yes to all of those questions, or yes to at least one here in Greater New Orleans. Here we have a model which outlines the results that we've come up with, basically linking things like post-disaster stress to physical illness, mental illness, behavioral disorders, self-medication, and social illnesses. Councilman Philco's office has gotten a copy of this, and I'll make sure that you also, Councilwoman Dora, get a copy. And the concerns voiced by your constituents can be tied to evidence and academic literature, so all of those things can be supported, but this was strictly from the voices that we gathered. And so going back to what Ms. Bouchard was saying, a couple of things that I did disagree with was the evidence that she gave that the community services were working. And a couple of things that she cited was that there's evidence that the system gets people in and out, but there's not evidence that their problems are being addressed. And I would say that as a result of what Steele has said and as a result of our crime waves here, that the system is not working. And I would also like to point to the language and pay very close attention to what's being said. There were some words thrown